Hi, today me and Picasso are going to walk you through my biggest takeaways from doing conservative treatment with my dog Hara, who's no longer with us. Hara was paralyzed from IVDD, intervertebral disc disease, and so everything I'm sharing comes from live experience. Excuse me, 5 years of caregiving, learning the hard way, asking a lot of questions and making adjustments along the way until I figure out what worked best for Hara in order to make sure that he had a happy, healthy life after the diagnosis. Picasso's now, he's not about this right now. But before I start, this is not medical advice, right? So check with your vet to make sure that you find out what works best for you and your dog. I just really hope that if you're feeling overwhelmed right now and trying to find answers, I'm hoping that you find anything that I say today helpful. So, big picture, set expectations. So, when a disc is damaged, healing mostly comes down to two things: time and a strict, great rest. There's no medication that repairs a disc. There's no shortcuts, no magic pills. There's like no 90% great rest. You have to just follow that. The goal during conservative treatment is simple. Not perfection. It's not speed or things like that for them to move faster, not even walking. The goal is for your dog to be pain-free, stable, and happy, like eventually back to themselves. Everything else is secondary. So you have to remember that, because I think that we're the ones who stressed out the most. So there's four phases, and I think I'll walk you through what those four phases look like. So phase one is pain control. That's like your immediate focus. Like pain control is the first priority. Pain from IVDD usually comes from the injury itself, muscle tension, nerve irritation. Most dogs need more than one medication to manage all of that. I know that when Hara, like those first 3 weeks, I think I had like multiple medications, and I can go into that into another video, but it was a lot to process, right? So, and what I learned is that if your dog's personality hasn't returned, that means that pain may still be present, right? So something to like watch out for is shaking, panting, the arc like back, if they're crying, tight belly, not wanting to move, just anything that where they're acting unlike themselves. That just means that they're in control. And when the pain is controlled, you'll know. They will kind of rest. They will look more like themselves again. You'll see that joy in their face. And if you don't see that within the first 6 weeks, maybe before that, just obviously check with your vet. I know that for me, I was like calling them like probably every once a week. So they told me obviously going to face like the first 4 weeks is like reduce the swelling, right? So swelling around the spine, it takes about 4 weeks to come down. So you have to remember that, right? That the medications you're giving them is going to help. Something that is really important to remember is to never mix steroid medications with non-steroid anti-inflammatories. Because switching between them requires a break in between to protect their stomach. So again, your vet can walk you through all of that. Things to look for are vomiting, diarrhea, blood, refusing food. Again, if you're seeing that within those four to 6 weeks, immediately call your vet, because that is something that they might just tell you, like, bring them in, or you might be freaking out, like, just give it some time. Phase three, the 8-week rule, which is the hardest part. This is where discipline matters the most. Damaged disc need 8 full weeks of a strict, great rest to scar over and stabilize. And again, a strict means no couches, no laps, no wandering around, no dragging, not even a bath, nothing. Like, it just means like, because even the small movements can make the tear on the disc, the tearing of the disc even worse. So, and I'll be honest, this is like the hardest part emotionally. you're tempted to loosen the rules, but you have to remind yourself that you're protecting them, and you're protecting the long-term outcome. I used to sleep on the floor with Hara for I think the first 6 weeks, and maybe all the way until the 8 weeks, because I was trying to make sure that he had me, and 8 weeks feel like a long time, but the longer that you can, follow those rules, it will make it so the healing happens. Phase 4 is nerve healing. So there's no timeline. Nerves heal slowly. Think like months, like not days. And there's no medication that repairs like the nerves. Some dogs regain bladder control and leg function, and some don't. Some improve gradually over time with the support of like therapy, like acupuncture or like laser therapy, because that helps to stimulate healing. But they're not magic, and again, it takes time. Progress can be slow, and sometimes you might not see a lot of progress, and that's normal. So just again, consult with your doctor to see kind of what that looks like for your dog. If paralysis happens, which is kind of obviously what happened to my dog, there's something I had to learn, and it's that dogs do not experience paralysis the way humans do. They do not measure themselves by mobility. They do not walk around feeling sad because their body is not what they used to be. They actually, as long as they're pain-free, they feel loved, they feel safe, and they feel included in everything you're doing. They will adapt. It will take some time, but they will adapt, and joy is possible. You will have those moments of joy with them. So again, get through the first 8 weeks, because then you get to what success actually looks like, right? And success isn't did they walk again. Success is, are they comfortable? Are they pain-free? Are they stable? Are they enjoying life? That's it. Their smiles, like that. Do you see them, recognizing, can you recognize them coming back to themselves? So I think that if you're in the conservative treatment, phase, of this right now, I know how overwhelming it can feel. But trust me, it becomes manageable over time, especially when you break it down, like pain, swelling, rest, and time. Pain, swelling, rest, and time. One day at a time. You don't have to have it all figured out. It doesn't have to be perfect. You just need to be consistent and patient. Consistency, patience, and again, making sure that your dog feels safe, that they feel loved, and that they feel included in what you're doing. I cannot emphasize enough, those first, 8 weeks will be emotionally hard, but you can do it. I did it, and just, take it one day at a time. So, yeah, I hope you found this helpful, and I hope I didn't ramble too much this time. But yeah, I guess thank you for following along, and until next time.